Shah. Um,
Thank
you
you.
know, mental health issues amongst the youth, particularly in India, was a huge problem even before COVID hit us. And post-COVID, certainly it is reaching, in our view, almost epidemic proportions. And if you're having, let's say, 100,000 students, I mean, statistically, it stands to reason. I'm sure many of our students would be facing some issue or the other, whether latent, whether known and unknown. But somehow, you know, the Indian society or really does not permit, so to speak, you know, free and frank discussions on this topic. There seems to be some stigma attached or some kind of hesitation people have. And the attempt in this session would be really to be able to understand from you some more nuances about and some of the questions which we have also collected from our students prior to the show. And a lot more questions would be coming in as we speak, and we will try and address as many as we can to you.
Certainly.
I will request to kickstart, I will request my colleague Shourya to introduce Dr. Shah and take it on from there. Thank you. Over to you, Shourya.
Thank you, Anuj. A very good morning to you, Dr. Shah, and welcome to this very special session for which has been organized for the next generation, who's also the future of the country. And I have been given the privilege of introducing you. So Dr. Shah did her DNB in Psychiatry from the National Board of Examinations. She's been associated with INHS Ashwini, which is the Indian Naval Hospital ship Ashwini in Kolaba, a very premier setup in Mumbai. She did her MBBS from the Maharashtra University of Health Sciences and has been associated there with the St. GS Medical College and the very famous KEM Hospital in Mumbai. She has over 8 years of practicing experience as a psychiatrist. She's been a consultant with the KLS Memorial Hospital and the Bharatiya Arogya Nidhi Hospital in Mumbai. She's been very instrumental in setting up the psychiatry ward in the Bharatiya Arogya Nidhi Hospital. And I can imagine the humongous effort that would have taken, Dr. Shah, on your part. So kudos to you on that. Her special interest is in mental health awareness and destigmatization. And she's focused on adult psychiatry and a balance of psychotherapy and pharmacotherapy. I think during the course of the discussion, you would explain the differences between that, because these are two technical terms, right?
Yes.
So as Anuj rightly mentioned, Dr. Shah, mental health today is of a key concern for everybody, and more so for the youngsters today, because as they get into facing different aspects of life, how is it that they should face the world? How is it that they should move ahead? And the entire ecosystem of late, you know, as Anuj mentioned, has become very fragile due to this unprecedented COVID-19 crisis. So you know, to begin with, I would ask you, you know, so we often talk of various things, you know, I am stressed out, you know, I'm feeling sad, and you know, suddenly I feel that you know, probably my palpitation has gone up. So how do we actually differentiate between these things, you know, stress or anxiety? And so over to you, Dr. Shah, to explain this.
Right. So the first thing that I wanted to talk about is that mental health. I am really glad that that has become something that has come to the forefront right now. Okay. What we have to first understand is what is mental health, and what has been great about the direction in which we're conceptualizing this is that when I started studying psychiatry, mental health or health in general was considered an absence of disease. So if you don't have disease, then you're healthy. And over the last 10 to 15 years, it has been moving to more of what we understand a balance. So it's a balance where your emotions, your personality, the way you think, your ability to cope when it comes to whatever function you're serving at that point in time. You're able to balance it. So as you very correctly said, that anxiety, palpitations, fear, sadness are very much a part of this dynamic. These are emotions that we face on a regular basis. So what we have to understand is, when is this normal, quote unquote normal, and when is it something that we should worry about and approach someone for help, right? So coming back to your question, the question I think was that how do we deal with fear, anxiety in everyday life? And how does stress play into it? So when we speak about stress in a medical term, we don't mean stress as in, oh, I have an exam tomorrow, or, I have to do something, I have to go for a job interview. That's not what stress is medically. Stress medically is any change from equilibrium, right? So even your morning exercise is technically stress. Okay, even having that cup of coffee is stress, because it's making your body adjust from where it already was. So not all stress is bad. And I think that that's the first thing that we have to take into account, that some stressors are actually good because it makes your body adapt, okay, and pushes us to grow. All right. When the stress becomes perhaps a little difficult to handle for multiple of reasons, that's when your body, and we use the medical term decompensating. So decompensating meaning that you're stretched to the limit. Now your adaptive functions are actually causing you damage. So that is that fragile balance that we're trying to keep, where we can push ourselves to grow, but realize when it's getting too much, pause, understand it, analyze it, process it, and then decide which direction you want to go. So that is the exact balance that perhaps a good psychiatrist or psychologist would help you bring about, or even a good mentor in that case. I think even you're educating students, you are stressing them in a way that they're learning new things, they're appearing for exams, they're doing things they've never done before, but that enables them to grow, right? So that is what stress is. Now, fear could be one of the ramifications. Fear and anxiety are some of the ramifications of stress. So anxiety is when your body prepares for a perceived dangerous situation, either acutely. So that means that's your classical, almost like a panic situation where your heart is racing and you're breathing fast and you feel like butterflies in your stomach and your hands start shaking. All of us have experienced that before any important or momentous occasion in our life, right? That's just your body saying, this is something important. I need to be prepared for it. I need to be alert. I need to have all my energy stores where I need them. So that's just your body relocating all the energy stores to fight that moment. So that is the acute part of it. And then your body also does a chronic thing. And the chronic one is actually the more dangerous one. This is why people who are under a lot of stress constantly, all right, they have these lifestyle disorders like perhaps diabetes or hypertension, because this is done through your endogenous steroids. So what it does is that's what people start getting acidity, the immunity starts going down. So all of this is what we don't understand, is that these mental emotions that you're feeling are ground in physical things as well. So it's not just something in your head. Your whole body is responding to that one thing in your head. And which is why it is so important to deal with this. Because a lot of people don't think that, oh, just a better quality of life. They'd be like, oh, it's in your head. Just snap out of it. But so you might not be able to get them to approach for help just to have a better quality of life, or to be able to be fully actualized or reach their full potential. But if you tell them that if you treat this, you will have better physical health, they sometimes agree to get help. So there's a Lancet study that was out in the early 2000s that said if you want to prevent heart disease, you want to prevent hypertension, you cut the risk by 50% by just treating anxiety and depression when it needs to be treated. So that's how important it is for your overall health as well. So that's how stress pans out to anxiety. and then perhaps the other mental health disorders as well, such as depression, and some of the other more biological ones as well. So I don't know whether that is clear. If I can just put one more term, it's so basically how you react to a stress mentally would depend on your genes. It would depend on your environment, which would shape your personality, right? And that would then lead to how you would, how much stress would be required for you to tip over.
Yeah, thank you, Dr. Shah. I mean, that was very lucid. Which brings me to the related point, as you mentioned. Many of us go through our lives believing us to be of a particular type. Let's say I believe that I'm introverted. I just like being myself. And in that process of being introverted, of staying to myself, I'm not able to distinguish between whether that's me as a person, or is it an extraneous imbalance which has got created due to the factors that you talked about. So I wanted to understand as to which portions of these are really personality traits, as it were, and which really gets termed as a mental health issue or an illness.
That's a very relevant question, because I often find parents coming to me in the age group of the child being 15 or 16 and saying, my child doesn't talk to anyone, doesn't like making friends. Is there something wrong with my child? They should go out, they should make friends, and they pressurize the child, put them in groups and things like that. So there's a lot of very interesting research done on this, that a child's personality is almost obvious in the first 3 years of the child's life. But we wouldn't use the term like a hard and fast personality or a personality disorder till the age of 17 or 18, because your brain is undergoing a lot of changes in that time. But they're saying that in a very easy way to understand, there could be children who are very curious, who are very interested in new things, who don't get scared to go to like new people that they meet. And you'd see that even like in a 7-month-old child or a 2-year-old child. This child goes to everyone, and the other child just sticks to mom and like starts crying if a new person comes in. So they're saying that the anxiety factor is something that you can see in children when they are very, very small as well. And what we tend to do is we tend to protect the child that's anxious because the child gets uncomfortable. So there's a very wonderful, lots of studies done on how to change that trajectory. But once the personality is set by the age of 15 or 16, okay, then that pretty much remains constant, all right? So if a person's introverted, that means that it's not that they don't like going to people, but they derive most of their energy or most of their resetting from solitary activities. So in fact, if they go out and they're hanging out with a lot of people, they in fact feel like a lot of their energy is being expended. They don't feel very recharged by such an interaction. So that is all right. But if we see a change from what you were before, so as a mental health professional, I'm looking more for like a dropping off, as it were. So the person is constantly a certain way, and then there is a drop off. Either the anxiety has gone up a lot more than there used to be, or the person has suddenly become more withdrawn than before. Or more importantly, something that we say that a change. So like, let's say if you are introverted and you like reading, or you like sitting by yourself and listening to music. Now, even that is something that doesn't appeal to you anymore. Like you start shunning that as well. So that's what we look for. So it's not a process of making someone who's introverted an extrovert. And it's not like, it would be difficult to mark it in that. But of course, if that introversion is coming with anxiety, then it becomes a problem. So we look for, there are certain personality disorders that would cause you to have a higher risk of developing certain disorders. So we'd like to address that as well. But if you want to demarcate whether this is a disorder like anxiety, like depression, like alcohol dependence or substance dependence or bipolar disorder, then we're looking for a change from a steady pattern.
Thank you, Dr. Shah. That's a very clear answer. My only supplementary question to that really would be that while you clearly explained that one is looking for a change, that is after they come to people like you. But
Yes.
what about the period before that they have come to a person like you? How does a person by themselves, what should they look for to which triggers a thought that maybe I need some help and this sphere. How does the patient or a yet to be patient recognize this fact that okay, there is a case for me to think that I may need help?
Right. So that is when someone has to look, and these are certain disorders that have insight. So all of these disorders, by insight, I mean that the person themselves know that something is going wrong, right? As much as we hate it, we tend to look for perhaps functioning and physical parameters. So let's say that you find that your energy levels are dipping. What you could do earlier, you're unable to do, or you have to drag yourself to do that. All of us have certain days, where we just don't feel like getting out of the bed, where we just don't feel like going to work or studying. That's normal. But if this becomes sustained and it carries on for some time, and by some time, I mean, it could even be just 2 weeks at a stretch or 10 days at a stretch, right? It's just going on. You can't seem to be snapping out of it. That's one thing. Some of the more dangerous markers are if sleep is getting affected very much. So, you're either waking up very early in the morning, or when you wake up in the morning, you just don't feel rested. Another one is where you find that your body is changing. So you're either putting on weight without wanting to, or losing weight without wanting to. So no changes, but your body weight has just started, going up or down. Another thing is, as I was telling you, energy levels and your interest in the things that you were doing earlier. So things that you previously found enjoyable, right? So whether it's meeting your friends, whether it's studying, whether it's watching a show on Netflix, everything just seems like a drag. You don't enjoy it. And of course, the final thing is your functioning. So whether you're at work or whether you're studying, you just find that you can't focus. One of the very common symptoms of both depression and anxiety are inability to concentrate, right? And this is like a change from what you were before. So if you notice any of these things, then it is worthwhile to speak to someone and see whether you should get help. So these are like usually the hallmark symptoms that we look for to know that something is now getting into I need help territory.
Yeah, we have a lot of questions coming on anger management and all that. We'll address those little later. But Shourya, you have a question for Dr. Shah?
Yeah. Yes, Anuj. Dr. Shah, you mentioned about the entire framework, the mental framework at the age of 3 getting formed, and then finally around the age of 16, 17 is where it kind of starts manifesting.
Yes.
Now,
yes.
During this entire journey, a lot of people go through various influences, be it family, societal, or whatever it is. And they also tend to develop some conscious and unconscious biases. So and when they are in this formative stage and forming their worldview or changing their worldview, which was formed earlier in the early teens and then the mid-teens. So what happens? How do they confide in people? Should they confide in their parents or their elder siblings? And what happens if somebody does not have an elder sibling? Who do they go to? Because even if they confide in their friends, most of their friends would probably be in the same age group.
Sailing in the same boat. Yeah.
Absolutely.
Yeah. I think that is that's a really great question, because a lot of times when we want help, we don't know who to speak to. A lot of the conflicts, especially in the teenage years, are actually with the parents. So, child psychiatry a lot of times becomes about counseling the parents rather than counseling the child so that they can resolve things better. But I do think that especially in this time as compared to when you were studying or even when I was studying, that I think teachers have become far more approachable. A lot of them are very, very sensitized to mental health issues. So sometimes even if you feel like you can't approach a family member, approaching someone who's a teacher, a lot of times when I watch a lot of these movies that are coming up, I was like, just speak to an adult, just speak to an adult and your problems will get solved, you know? You see these teenage crises and I was just like, just reach out to someone. So sometimes friends would only serve, as you said, like a ventilation kind of thing. You just say what you're going through and you might get an echo chamber, or you might have a good friend who says, do you want to think about this differently? A lot of schools have counselors. All right, so counselors are a really, really good place to be. There's a lot of stigma. I remember when I was studying, if a child was pulled up in class and said, can you go to the counselor? Everyone looked at the child like there's something wrong with you. Why are you going to the school counselor, you know, or the college counselor? But I think that over time, these offices have been made very, very approachable. Like, you know, they're more like a hangout zone with like, you know, this adult just there and you can just drop in out, like it doesn't have to be a formal thing. So I think that if you have that ability or you have that resource of having a counselor, please use it. If they find that there's something wrong, they will be able to forward you to someone who's perhaps in a better way to address your problem. So school counselors, teachers, all right, it can sometimes, if you can't speak to your own parents, sometimes speaking to an elder sibling or a parent of a friend also turns out okay, you know, because they have that little distance. They don't get defensive because you're presenting a problem, but you might be able to get a balanced perspective, or at least perhaps just a kind of grounding in some way, like just to prevent you from getting into some real trouble, I think. So that is another resource. And I think that a lot of group therapies exist in Bombay, you know, so if you don't want to worry about, you know, spending a lot of money, or you don't want to formally go to a psychiatrist or a psychotherapist, there are quite a few resources. Actually, a lot of them my patients only bring to me saying, you know, I'm going here also a couple of times a day. So there's a lot, a week. So there are lots of these group psychiatry or group psycho counseling sessions that are also happening. They're not as hardcore as a one-to-one therapy session, but it gives you either a support network, or it at least gives you a kind of mentor situation, which would be helpful. So I think current day India is doing, like, you know, there's a lot more opportunities to seek help. That is I think that is what I would suggest.
Thank you, Dr. Shah. I think that gives us a good practical viewpoint, if I might say it, on how to go about things. But you threw in a couple of terms there, just stepping
Right.
back in terms of just to help us laymen understand those roles a little better. How is a counselor different from a psychotherapist, and how is that different from a psychologist? How is that different from a psychiatrist? And whom should one go to really for what purposes?
Right. So I will first start with the difference between a psychologist and a psychiatrist. Both of them are mental health professionals, but a psychologist has done an arts degree. So they've done a BA arts, and a lot of them actually have to do an MA, an MPhil, or a PhD. So they've gone down the humanities thing. And what they do is they can do counseling. They can do psychotherapy. Psychotherapy is otherwise called talk therapy. So that's what you normally associate with going to a mental health professional. What the movies say is a shrink, right? So that is the talk therapy, all right? And a psychiatrist is someone who's got a medical degree. So they've done an MBBS. They're a doctor, okay? And after that, they've done psychiatry. So perhaps a layman differentiation is that a psychiatrist can prescribe you medicines and a psychologist cannot. That's how people usually see it. A lot of psychiatrists, because we have a dearth of mental health professionals in India, perhaps we have only about 5,000 odd psychiatrists in all of India. That's really less for the population that we have. Considering that, I think WHO had done a campaign saying 1 in 4 people have some mental health problem. So we really have lesser. So a lot of psychiatrists do tend to concentrate on the more medical or the pharmacological, the medicine, like giving the pill aspect of the treatment. And the psychotherapy is when you talk. Now, how a counselor is different, and without going into like a lot of details of it, a counselor is someone who kind of guides you and perhaps also tells you answers, right? So they're more like speaking to, like, you have like a career counselor, a school counselor. So it's not very in-depth of an exploration, right? It's more of, okay, this is your problem, these are our possible solutions, which one do you want to do, right? But in psychotherapy, through different modalities, you are allowed to explore who you are, okay, and perhaps understand why you are making the decisions you are making, and then do a change, like Mr. Shourya had explained, that you develop certain biases, right? So they help you reframe those biases or change those biases so that they don't have to tell you, okay, choose this profession. You'll be like, okay, this is who I am, this is what I need, so this is what I'm going to do. So that's how psychotherapy is different than counseling in just as a basic understanding of it. But those terms are kind of used interchangeably because, depending on how open the person is to this exploration, I might have to convert to a counseling role if the person is unable to really explore. So if the person is in a very, very severe depression, or the person is not very psychologically oriented, I might just have to do just the problem solving kind of thing. So those roles are fluid, but this is how we normally use it.
Thank you, Dr. Shah. Shourya, over to you.
Yeah. So, Dr. Shah, you mentioned about the difference between a counselor, a psychologist, and a psychiatrist. But my question here is that in the advanced cities or the tier 1 cities like Delhi, Mumbai, Bangalore, Hyderabad, Pune, society is very open. The education system is more open. But a lot of people in the tier 2, tier 3 cities, how open are they? I mean, it is still considered as a stigma. I mean, not that even in a place like Bombay, it is not.
Yes.
Firstly, as you rightly said, that the parents need to be counseled more than the children first. So how do we strike that balance? How do we, do away with all of these stigma or mental blocks, if I were to put it?
Right. I think that this basically comes from the stigmatization of mental health in general and mental health disorders, right? So how I normally explain it to family members that come to me, because they're like, "Main pagal nahi hu, I'm not crazy. Why should I go to a mental health professional?" Right? And even I catch myself being in this profession for this long, doing psychiatry since 2008. I still find myself saying, "Oh my God, that's crazy. Oh my God, that's mental," or like, there are some people who be like, "Are you psycho?" These are such parts of our everyday talk, and they have such a negative, pejorative or connotation, so the first thing that's going to happen is that we have to normalize having a mental health imbalance in any way. And that can happen from basic things like changing the way we speak, right? Just like if someone's doing something different from you, you just call them crazy or tu pagal ho or things like that. Even at a road traffic altercation, you'd be like, pagal hai kya? Thana chala ja, things like that. So there's just such a negative thing attached to mental health, right? So that's the first thing. The second thing is to understand that going to a mental health professional, like the example I give is, let's say you go to a dermatologist, or you go to an orthopedic surgeon, or you go to a physician. Not everyone who goes to a physician has a cardiac problem. You can have a cold, you can have diarrhea, you can have an infection, you can have diabetes, you can have hypertension, but you still go to the same doctor. Okay. Similarly, if you go to a psychiatrist, it's not just like, the very severe mental health illness like schizophrenia. That's what you normally picture as someone who's crazy, someone who's mumbling to themselves, hearing voices, doing eccentric things. So it's not that only those people go to a psychiatrist. You can go to a psychiatrist even for anxiety, even for mild depression. Go to a psychologist if you don't want to go to a psychiatrist. They'll see whether you need medication, and then they can refer you onwards. But the main thing is understanding that mental health disorders are a spectrum, They're not just one solid entity. So that becomes a second thing. And the third thing is understanding that earlier we had very few treatment options for our severe mental health disorders. So if you had, like a psychotic disorder, we try not to use that term, but it's the easiest to understand. That's when your sense of reality is completely lost. So you don't know you're unwell. Okay. So, that's when you start hearing voices, or you start thinking people are trying to harm you. That we had barely any treatment options for that now. Now we have medicines. Now these people can return to some semblance of a normal life. I've had patients with schizophrenia going on and doing an MBA, getting a job. So the thing is, getting hope back and not being nihilistic about it. That there is no treatment for this. Just suffer through it. A lot of my patients say that their relatives tell them that, you just have to just do some yoga, you'll feel better. Just eat healthy, just snap out of it, just get up and study, So the thing is to understand that there are certain things that you can snap out of, but there are certain things that you need help. And it's not always the really severe cases. So sometimes just the fear of what if the doctor says I'm crazy is what prevents them from going to a doctor. So I think that the main work is this destigmatization, is to know that this can happen to anyone if their gene and stress balance goes off.
Dr. Shah, thanks for that answer. And I want to shift gears a little bit, shift the scenario a little bit now
Right.
to the parents. Let's assume that, there is a person in the family who has a mental health issue, and he has seen a psychologist or a psychiatrist and is undergoing some form of treatment. Now, the question, as you also indicated in the beginning, that sometimes the family members, and in particular the parents, are the problem themselves. Problem in the sense that the genesis of the problem with the patient has is emanating from the parental behaviors or the environment in the house, or a particular happening in the house. So, as a parent, what is your words that you would tell the parent for a person who has a person in the house who is undergoing treatment? Because as a parent, sometimes they go into a sense of guilt. Arey, maine aisa kya kar diya? Have I gone wrong in my upbringing of this person? So what's your words for the parents? Because I believe we have a lot of parents also listening in today.
Yes. So what I normally tell my patients, because I deal with people who are above the age of 17 or 15 at least, because I like doing the psychotherapy part. So I like to have someone I can reason with. But a lot of times what I tell my patients is that barring a few such cases, most parents have good intentions, right? Most of what they are doing is because they think it will be helpful to you. So what I tell them is to give kindness to the fact that they are human, okay? And they are trying to do the best with the knowledge that they have. Unfortunately, we don't have enough knowledge disseminated in an everyday situation for what mental health is and what are things that would foster good mental health or resilience, okay? So the first thing I tell my patients is you have to learn to understand your parents' perspective. And what I tell the parents is that this is not guilt, because even they did the best they could. But as long as you're ready to listen to an alternate perspective, okay? Not just because I said it, it's true. I know I've seen more of life than you have, so I know, right? This generation is not going to respond to statements like that. They're very inquisitive, they're very curious, and they have a lot more sources of information than we had when we were growing up. So it sometimes is good to keep an open ear, to keep and talk to your children, and vice versa, right? If you feel like you can't talk to your children, talk to a friend, get the friend to talk to the child if the child is okay with it, or you go to a counselor and say, this is what is going on. My child is small. I don't know whether what I'm doing is right. I really admire, I have a lot of adult patients who say, what? When I went through this, I realized that the way I view the world is wrong. I want to know what values I want to pass on to my children, because I want to see my values are outdated for the world right now. I don't know what to pass on. So just because you are a parent doesn't mean you know everything. There's nothing wrong in accepting that we don't know everything, right? Keep an open ear, speak to your children, speak to people around you, speak to a counselor. Okay, it's guilt, I think, doesn't help because it doesn't allow you to change. It just becomes like a whip, you just keep whipping yourself. If you see that there's something that you're doing wrong, accept it, acknowledge it, and work to make it better. I think that works better than guilt. Just learning to change.
Which also is an issue sometimes, one of the, in my experiences, the reason why parents tend to bottle it up and say, because they don't want anybody else to come to know that his child is, his or her child is undergoing therapy from a stigma perspective. Before I dive into some specific questions that have come up onto the screen from the audience, what is your, general approach that we as parents or as friends or in the peer group should be able to do? How open should we be about this? Because I mean, there is maybe a flip side to becoming too open about it. Also, given the
given the stigma attached to it.
Yes. So how does one find the balance? What are your words there?
I think that as long as you keep your conversation to the symptoms rather than the conditions that cause it, because the symptoms are universal. Okay, I find it so, but beautiful would be the wrong word. But I just find it so interesting that it doesn't matter which socioeconomic background you come from. It doesn't matter how much you've studied. Depression would manifest with the same symptoms, right? It would come with sadness. It would come with a loss of interest in activities. It would come with reduced energy. It would come with guilt. Okay, so as long as you keep the conversation to the disorder, like if you see, like if I have to talk about diabetes, I'd be okay with talking about my just my sugar levels. I don't want to go into the details of like what diet I ate and why I got diabetes. So that's the analogy I'm trying to give. As long as the person who has the disorder is open with talking about it, then the other extended family members can talk about it, right? And if you stick to the symptoms, right, it becomes easier. Because a lot of times what happens is there's a lot of confusion here because we think depression is one entity. So when you speak to a friend, like I have patients who are severely depressed to the point of contemplating self-harm, okay, and whose parents say, a child of my friends had depression and they managed without medicine. So why are you prescribing medicine to my child? So I think as long as you stick to the symptoms and, what was relevant for you, it becomes important. And I think a lot of people in a position of, I think, put on a pedestal in some way. Like I think Deepika Padukone did that kind of thing about how she was depressed. She, there's a lot of hush-hush around mental health disorders. So I think when people who are perceived as strong or fighters, or if they talk about their mental health journeys, it becomes easier. It becomes a little more inspirational for people to know that, I don't get a mental health disorder because I'm weak or because I'm fragile in some way. It can happen to anyone.
Just the way diabetes can happen to anybody, for that matter.
Exactly.
Although some may be more prone to it than others, but
exactly.
While some may be more prone to having diabetes, but at the end of the day, it can happen to anybody.
It can happen to anyone. Exactly.
Just the way there is no harm in talking about diabetes, as long as you're sticking to the symptoms part of it and not getting into this, what's causing it, you feel it's good. That's very good practical advice. Shourya, you have a question?
Yeah, Dr. Shah, I hope you're okay if I ask you a question in Hindi. I have this habit of breaking it.
Yes, certainly. No, of course. Sure. Yes,
right.
Yes.
So, you'd mentioned about the destigmatization. What happens is, अगर हम कहीं शहर में हैं और बच्चा हम चाहते हैं कि बच्चा एक तरीके से पढ़े या एक तरीके से खेले या एक तरीके से बड़ा हो या अपने दोस्तों के साथ मुलाकात किस तरीके से करे, कब करे. Like I'll tell you an instance. When we were growing up, we had a clear directive that before sundown, you need to be back home. Otherwise, we would get a 360-degree ear treatment.
Yes.
Right. So, हमें क्या जरूरत है कि हम गार्जियंस को, पेरेंट्स को शिक्षित करें और उन्हें बताएं कि मेंटल हेल्थ जो इशू हम देखते हैं ये एक्चुअली इशू नहीं है, ये नॉर्मल चीज है। किसी को, जैसा आपने कहा, किसी को भी हो सकता है, तो इसमें घबराने की बात नहीं है, इसमें डरने की बात नहीं है, ये नॉर्मल चीज है। तो इसको हम कैसे बता सकते हैं लोगों को, परकोलेट इट फर्दर?
जी, मेरे हिसाब से आई थिंक आपने सही बताया कि शहरों में अभी ऐसी पाठशालाएं हैं जहां हमारी प्राइमरी सेक्शन नर्सरी से केजी तक जो रिपोर्ट कार्ड्स है उसमें वो लोग ऐसी चीजों पे रेटिंग करते हैं जैसे कि चाइल्ड क्या क्रिएटिविटी कैसा है, चाइल्ड दूसरों के साथ बात कैसे कर पा रहा है, वो कैसे एडजस्ट कर रहा है। मतलब सिर्फ शिक्षा ग्रहण करने की बात नहीं है उसमें, इसमें कि हम देख रहे हैं कि चाइल्ड कोई भी परिस्थिति से एडजस्ट हो पा रहा है कि नहीं, राइट? तो अगर मैं ये नहीं समझती कि हर बच्चे को सेम तरीके से बड़ा किया जाए, जैसे कि हम बोलते हैं कि जिनमें नेचुरल बहुत क्यूरियोसिटी है, राइट, उनके ऊपर कोई भी रूल्स ना लगाया जाए तो वो आगे जाके बहुत ही डिसरप्टिव हो जाते हैं, बहुत ही व्हाट डू यू कॉल इट, लेकिन मतलब ड्रग्स की तकलीफ में जा सकते हैं वो लोग, एंटी सोशल पर्सनालिटी की तरफ जा सकते हैं, राइट? सो हमको हमारे बच्चे की पर्सनालिटी समझनी है। जो एंशियस बच्चे हैं उनको हमको थोड़ी एक्सप्लोर करने की प्रोत्साहन देनी है। तो हर बच्चे के लिए ट्रीटमेंट अलग है, लेकिन ये हम उनको कैसे बता सकते हैं कि मैं यही यूज करती हूँ कि अगर आप आपके बच्चे को सफल होना, सॉरी आई रिफ्रेज दिस वन सेकंड, अगर आप चाहते हैं कि आपका बच्चा सफल हो, तो हमको उसकी मेंटल हेल्थ का भी ध्यान रखना पड़ता है, क्योंकि अभी इतनी कंपेटिटिव दुनिया है, ओके? और अभी सब लोग उसी शहर में नहीं रहते, तो लाइक अमेरिका की तरह अभी बच्चे दूसरे बड़े शहरों में जाके काम करते हैं, अकेले रहते हैं। सब लोग जहां बड़े हुए वहां ही नहीं रहते पूरी जिंदगी के लिए। तो हम यह नहीं चाहते कि बच्चे सिर्फ मार्क्स लाए, हम ये चाहते हैं कि जो भी प्रॉब्लम आपके बच्चे को हो वो अपने आप सॉल्व कर पाए। तो हमारा पहला जो पेरेंटिंग मॉडल था वो ज्यादा प्रोटेक्टिव और आदेश देने वाला था, मैं आपको बताऊंगी क्या करना है और आप वो करो। और हमको वो मॉडल चेंज करके यहाँ लेके जाना है कि हमको इंडिपेंडेंट बच्चे बनाने हैं। हमको ये नहीं चाहिए कि बच्चा सिर्फ किसी की बात सुनता रहे पूरी जिंदगी, वो लोग प्रॉब्लम देख सके, प्रॉब्लम को कैसे सॉल्व कर सके, वो हमको सिखाना है, राइट? और वो सब सिर्फ मेंटल हेल्थ, ये नया शब्द आ रहा है जो है रेजिलियंस। रेजिलियंस मतलब कि बच्चा या अडल्ट कैसे कोई भी स्ट्रेस के साथ अडेप्ट करके ग्रो कर पाए। तो अगर हम इस डायरेक्शन में पेरेंट्स के साथ बात करें, नॉट जस्ट के अगर ऐसा नहीं होगा तो, नॉट वो पूरा फियर वाली बात नहीं है कि अगर आप ध्यान नहीं देंगे तो बच्चे को एंजाइटी हो जाएगा, अगर आप ध्यान नहीं देंगे तो बच्चे को डिप्रेशन हो जाएगा, क्योंकि फिर वो गिल्ट चालू हो जाता है। लेकिन हम अगर ग्रोथ की तरफ ये पूरा कॉन्वर्सेशन लेके जाए तो मे बी वो लोग ज्यादा रिसेप्टिव होंगे ये बात को सुनने के लिए कि दिस इज गुड आपके यूनिट के लिए, एज अ फैमिली यूनिट ये आपके लिए अच्छा है, आपके बच्चे के फ्यूचर के लिए अच्छा है। दैट इज हाउ द आई थिंक द कॉन्वर्सेशन शुड गो, कि more towards के adapt. Yeah, yes,
what you're saying is that we need to be flexible in the way we approach different situations. मतलब हमारी जो सोच है उसमें लचीलापन होना चाहिए कि हर चीज को अलग तरीके से देखें, एक ही नजरिए से नहीं देखें, क्योंकि वो नहीं बैठेगा।
Absolutely right. Flexibility of approach. Yes.
Dr. Shah, thank you so much. You know, now I want to just turn the conversation to a little more serious or more manifestations of an illness. I mean, but like one of the viewers is also raising questions that she has a lot of anger, pent up anger, which she has to somehow release. and her
Yes.
manifestation of this is in terms of anger. And there could be other manifestations, could be in terms of substance abuse, or
Yes.
drugs,
Yes.
or as you said, self-harm or suicidal thoughts. So
Yes.
in those kind of situations, what is your suggestion if you start from, let's say, anger or any form of manifestation, and you'll be, of course, know what are the other forms of manifestation of this.
Right.
How does one control that part? How does one control their anger, or how does one control
Yes.
your own tendency of letting go towards substance abuse and stuff like that?
Right. So let me first deal with the anger part, right? So the first thing that I would say, like a short answer to that, would be mindfulness. All right. But the long answer to that would be that as people, now we have different psychological concepts for everything. But one has to understand in a broad way, we view how people react to things as internalizations and externalizations. So internalizations would be anxiety, depression, thinking badly about yourself. And externalizing would be anger, substance use, breaking things, throwing things. That would be externalizing. So you kind of act out instead of acting on yourself. Okay. But all of them are stemming from some kind of negative feeling of some sort. In India, we don't talk about feelings much. We don't like it when people show their feelings much because it makes us uncomfortable because we don't know how to deal with it, right? So I think the first thing is to be aware of how you're feeling. Anger is usually as a result of pent-up frustration or disappointment over and over, which has either not been processed or not been expressed. Okay. So if a lot of people tend to think that, if someone is repeatedly doing the same thing to us over and over again, they'd be like, I didn't tell them anything. I didn't tell them anything. They still kept doing it. It's like they still kept doing it because you didn't say anything, right? So it's not, and what people think is that expressing something straight away leads to conflict. So we have to learn how to express things to people without aggression. So I normally tell my patients to be able to have a conversation in a neutral tone or in an assertive tone. So assertive would be different from aggressive. Aggressive would be of more like a name calling or a blaming kind of thing. And neutral would be, this is what is going on. Why are you doing this repeatedly? Is there something that's happening? I noticed that you did this yesterday. I noticed that you did this today. Do you want to talk about it? Do you want to tell me why this is happening? So neutral is just trying to understand the other person's perspective. And assertive becomes about what works for you and what doesn't work for you. So a lot of times, if you are aware of the small infractions, the small irritations that you have, they don't build up to this anger or rage thing. So mindfulness is a wonderful thing for people who are dealing with anger. And there's a lot of exercises for mindfulness available online now. There are some beautiful apps that help you do it. There are a lot of apps that help you log how you're feeling every day. And a lot of these are free. So I think that exploring what is making you feel angry or frustrated and addressing it or processing it at that time rather than letting it fester is the best way to deal with anger. That is about anger. About substance use, I would really like to differentiate between harmful use of a substance and substance dependence. Substance dependence is what we used to call addiction. And that usually requires specialized care to get out of it because it's not just a question of control. It's actually become a disorder now. So you can't stop it on your own. So especially substances that have a lot of physical withdrawal, like nicotine, alcohol, opioids, they definitely require a professional to help you get off it. Nicotine, some people luckily can go off cold turkey, but because it is such an acceptable substance to abuse, not many people go to doctors or anyone for it. Okay. But there are certain disorders. I think now cannabis use has become very, very widespread. Okay. And for some people, it doesn't grow. It just remains like, once in a week, once in 2-3 weeks, you meet friends and you smoke up. But for a lot of people, it becomes like an everyday thing, coming to a point where they're unable to function. Right. So again, gets me back to the first thing. The minute you find that it's taking over your life, you're not able to function anymore. If you try to stop it, you find that your function is deteriorating rapidly. That's when you know that you need to get help for it. So the stress is that not all substance use is just a question of self-control or willpower. Some of it does require specialist help.
Yeah, thank you. I think this also answers this one viewer's question, which उन्होंने बोला है कि मुझे प्रॉब्लम है कि मैं सोचती कम हूँ, बोलती ज्यादा हूँ, मुझे खुद पे कंट्रोल नहीं होता, खुद को कैसे कंट्रोल करूँ, बहुत कोशिश करती हूँ, बट फिर हो जाता है. So that's basically it. I think the same, it's related to the earlier part which you talked about, this part. So I think that also answers this question, which one viewer had posed. Yeah, Shourya, you have a next question.
Yeah, Dr. Shah, you mentioned about mindfulness apps and how we can increase it. Isn't it a contradictory thing? On the one hand, we tell children to stay off your digital device.
Yes.
And then we say app. And on top of that, there are बहुत सारे लोग हैं जो आजकल ये मेडिटेशन पे स्ट्रेस देते हैं. मेडिटेशन करो सब काम हो जाएगा. फिर लोग पूछते हैं कि मेडिटेशन करे तो कैसे, मेडिटेशन करे तो कंसंट्रेट करना पड़ेगा, मुझे कंसंट्रेशन नहीं हो रहा है. So what is it? I mean, ये सारी चीज में मतलब कोई कैसे समझे कि मुझे क्या करना चाहिए, क्योंकि कभी-कभी बच्चों में क्या होता है कि वो बोलते हैं कि मुझे कोई नहीं समझता. And I'll give you a personal example, A couple of months ago, my son, he's around 17, and he came and told me, Dad, in your time, why you listen to your parents? So I didn't have an answer. I said, why? He said, because आपके समय में Google नहीं था. I mean, अब इस सवाल का मैं क्या जवाब दूं? लेकिन आप जो अभी बोल रही हैं कि वो सही है कि हमारे समय में एक ही इंफॉर्मेशन सोर्स था, वो हमारे बड़े बुजुर्ग लोग थे. लेकिन आज there are multiple sources of information. So how do we strike that holistic balance? क्या करें? As you said, physical health, mental health, everything is important. But how to strike that balance?
Right. So I'll handle it in three ways. The first thing is, what is the difference between mindfulness and meditation, right? So mindfulness का ये मतलब होता है कि आप जब जो कर रहे हैं, आपका पूरा ध्यान, your entire concentration. Are you there?
Yes.
Okay, sorry, my video just froze. Right. So आपका पूरा ध्यान and full concentration should only be on that one thing. तो जब मैं आपसे बात कर रही हूँ, मैं ये नहीं सोच रही हूँ अरे मुझको ये भी करना था, मुझको वो ईमेल भी भेजना था. मैं जो कर रही हूँ, मेरा पूरा ध्यान उसी में होना चाहिए उस समय. So that is mindfulness. Meditation is a means to achieve that. Okay, but the thing is, it's not a one-stop solution. हर mental health problem में steps होते हैं, degrees of severity होती है. So before you go into a moderate or a severe grade problem, meditation sometimes helps. Okay, but once you go to at least a mild or moderate grade problem, you cannot expect someone who is anxious, whose whole heart is like beating constantly, कि आप 30 minutes एक जगह पे बैठ के ध्यान दो, right? So you have to shift it based on that individual person. So sometimes then you just treat, like I might say, okay, if you can't start with just sitting in one place and breathing, like let's say you choose walking as your mode of exercise, or you choose yoga as your mode of exercise. Try to focus on what you are doing at that time. Okay, so if someone's going for a walk, what I tell my patients is choose one thing you're going to observe that day. Today, I'm only going to observe different types of trees. Today, I'm only going to observe like what bird calls I can hear. So the thing is, instead of it just becoming a mechanical, put one foot in front of the other activity, okay, you are making it a mindful activity that whatever you are doing at that time, your whole focus is on that. The importance of that is, then that is the only way you will be aware of how you are feeling. if I am only present now. We are living in such a distracting world, right? Earlier, I remember that I could, we might know from a time before cell phones. If I'm doing my homework, if a phone rings, I'll go like, I can hear it ringing in the whole house, and then I'll go and pick it up. But now if I'm studying something and there's this thing on this table, it'll just keep going ting, ting, ting. I'm scared. Did I hear it? Did I not hear it? Then I'm checking it constantly. Oh, did I miss something? It's such a distracting world. So it's very important to be mindful because there are so many sources of distraction that if I'm feeling angry, I can just distract myself, do something else and let it fester till it comes back again. If I'm sad, I can distract myself, do a Netflix and chill, let it fester, and then it becomes a depression that I can't handle, So that is where mindfulness comes from. But to think that meditation or exercise or any other such thing is a one-stop solution, even for that term, even antidepressants, that's not a one-stop solution for everyone. It doesn't suit everyone.
Right.
So to know that, some things are proper for certain times. It's like that. Right? So that is the difference between meditation and mindfulness. There was one more question, I think, that about sources of information, right? So mindfulness, of course, you can do it offline. You can do it, like, as I was saying, walking, right? For some people, because they are on their phone all the time, I was like, well, you're on your phone all the time. Use it for something that's useful for you. So, don't just mindlessly scroll through Instagram. Don't just mindlessly, sometimes I remember that you watch so much digital content that at the end of the day, if someone asks you which movies did you see, you'd be like thinking for 3 minutes. I don't even remember what I saw. It's kind of like that. It's just on, so at least spend some part of your time. Most people, while they're eating their meals right now, are watching something, so when you're eating your meal, mindfulness can be in small things like that. Texture, where am I feeling that meal? Where is the chili hitting me? Where is the lemon hitting inside my mouth? It can be something as simple as that. Doesn't have to be app driven, but if you are tech oriented, then please use the apps.
Yeah, I think, but the flip side to it, if I can dig a little deeper to what you said, there's a question here which says how to deal with overthinking. I'm not sure what they mean by this, but the question, which I can interpret this question is that while you're thinking of one thing, where does one drop the line? Suppose I'm now contextualizing into the current COVID scenario. Let's say, there is you've lost, somebody has lost a job or something else adverse has happened, and then you're constantly drawn into thinking about that. Ab kya hoga? How will I manage? How will things work? And so the question which I think what they mean is, how does one get to control that kind of as thinking?
Right. So overthinking, normally, as you very correctly said, is a worry loop, right? So it basically just circles around 3-4 points. Abhi kya hoga? Abhi naukri chali jayegi to, abhi paisa nahi milega to, abhi ye exam nahi hogi to, mujhko admission nahi milega to. So it just goes in this loop and it just keeps going round and round and you can't control it. So a lot of times, just as I was saying, like a basic meditation or breathing kind of thing will help to break the loop. But in terms of, I always tell my patients that when you're going in a worry loop, you're not going far enough. So it's not overthinking, it's thinking the same things over and over again. Okay, so a lot of times I tell them that, can you make a worst case of your worst case situation? Go like one step further, go a step beyond that, then go a step beyond that and see, okay, what is the very worst thing that can happen? Do you think you can handle it? Right? And if you can't, let's come up with a plan for it. Ask someone for help. If you can handle it, then that puts an end to that. So if I've lost my job right now, what's the worst that can happen? I won't get another job. What is the possibility of that happening? What can I do to prevent that? So it moves more towards a problem-solving approach rather than just like a loop going in your head over and over. So I would like join the two together. So I would do a behavioral thing to calm my brain down so I can focus, and then I would focus on these things.
Yeah, I think this also answers the another question which had popped up, which is, ma'am, I think too much. Sometimes I feel like I cannot concentrate on study or on my job. Yeah, I think that covers that part also. Now, the other question that I had jotted down was, particularly in these stressful times of COVID, how does one, there is a lot of things that stay positive. We keep saying,
Yes.
always think of positive things. Any tips or any kind of thoughts that you can say, how does one build positivity in one's life?
Yes, this is a very good question, and this is something I really like talking about. It's a concept called resilience. I'm saying this because then you can go look up more things on it. But resilience is where psychiatry is now headed towards. So earlier, psychiatry was all about early detection and early treatment. Now we are moving towards prevention. What can we do to build adaptability? What can we do to deal with stressors in a more helpful manner? And there are some wonderful tips for it. The first thing was this concept called optimism. So for everything that is going bad in our life, can we think about something that's going well as well? So balancing out that negative and positive equation is one way to do it. Another way is through gratitude, right? So for everything that I don't have, can I think about something that I have? Gratitude is another thing that helps. Physical exercise, definitely. At the end of every session like this that I do, I tell them, if you don't take anything from this whole 1 hour, just take that exercise helps. And you don't need to be like building a 6-pack ab. You don't need to be like, pumping iron for 2 hours. Just a 15 or 20-minute walk every day is enough for your mental health, for resilience, for adaptability, not if you have depression. Okay. Then things like support networks. All right. These are things that are very, very important. All right. Seeking help is a behavior that has been seen to really work in how people adapt. So knowing that this is beyond me and getting help for it from anyone is a behavior that is seen in people who adapt to circumstances better. Seeking knowledge is another one. So like, let's say that here you are mentoring people, you're giving vocational help, right? So they can approach their teachers, they can ask them, okay, there are no jobs available, but how can I diversify? What can I do? So if you lose a job, you can at least say, okay, how people who are working in this field, how are they noticing now? So getting information is something that's very, very helpful. It really helps with those thought loops, right? But this optimism and gratitude, exercise, and networks, these are the 4 things that I would definitely suggest for people to do. There's a really huge database of information on how to increase resilience. So for anyone who's interested, I would really recommend doing that. It's a really it's not something like how we said, okay, you either have a gene for it or you don't. It's not. It's something that you can build. It's not that you either survive or you fade or wither away. It's not like that. It's something you can build. It's something you can actively do to improve your life.
Yeah, that's, now the questions are flying in real nice and thick, So, we are running a little bit of time. I'll just take a couple of more questions, if it's okay with you.
Yes, certainly.
So obviously they are coming in all different directions. Question is how to calm down our mind while trying to sleep.
Right.
You had mentioned that the importance of sleep sometime in the early part of the show.
Yes. Sleep hygiene is another thing that I always talk about. I use these technical terms because all you have to do is Google it to get more information. That's why I use terms like resilience and sleep hygiene, because there's a lot of information available about this. But I was coming back to the fact that we're living very distracted lives, and the way we live has completely disrupted our diurnal cycle. So from the time we invented electricity and the light bulb, we are not following the natural day cycle anymore. Our brain secretes chemicals depending on sunrise and sunset that help us know when it's time to go to sleep. And most of us are on a screen till the minute we go to sleep. So we move from from a laptop to a TV to a phone. And a lot of people say, to unwind, I watch a movie, right? So this is a blue light, a white light emitting screen with flashing lights. Every time the picture changes, light is flashing inside your eye. That stimulates your brain. It will prevent you from falling asleep. So definitely for the last 1 hour of your day, I would suggest at least don't watch a video. So I remember that when we did not have the internet and we didn't have smartphones, we used to listen to the radio before going to sleep. So it's more of an audio de-stressing. So the point is, maybe none of us have radios anymore in the house, but switch to audio if you must have that stimulation. Or go totally old school, read in a backlit space. All right. So no light shining on your eye. Okay. And don't read on a screen, please. Okay. That defeats the purpose. So read a book, read something that you've been struggling to read. Perhaps read your study books. That will really put you to sleep. That's what used to work for me when I was a student. And another thing that we can do is perhaps do something that is, again, I'm using the word again and again, is a mindful activity. So it can be something as simple as, just drawing parallel lines on a paper, just kind of zoning out and doing something like that. It doesn't have to be something like, I need a coloring book. You don't need to buy things to be mindful. Okay. Or there, again, for people who are tech oriented, put your phone on night mode. There are a lot of these sleep casts that are available on the internet. It'll just be a person droning on monotonously about some calming thing. And I always tell my patients, I don't know what they talk about because in the first 5 minutes I'm out. So, it's very, very effective. But also certain other things is like, try not to drink a lot of water in the last 1 hour before you go to sleep, because then you'll have to wake up in the middle of the night. So just small, like, a lot of us, now that we are homebound, right? We're spending the whole day on the bed. That will again prevent yourself from going to sleep. So most of them do their homework in bed, they do their work in bed, then they go to sleep on the bed. So this is the technique from the old joint family systems. At least change the bed sheet at night, so your brain knows this is off time. It's time to switch off. So, these are small tips. But if you want to read more about it, there's a lot of this sleep hygiene stuff. Most importantly, no caffeine after 5 p.m. So that is something. So green tea has caffeine too. Just remember that. So okay.
Yeah, you're rolling out all the good things in life, but that's what doctors do.
Yeah, I know. Yeah.
No, but on a more serious note, one of the tricks that I had developed early on when I used to have some sleep problems, that not going to my bedroom till the time I'm ready to sleep.
Yes,
and
not
so
being
that
on
when I
your
see
bed.
my bed, yeah, so that was
Yes.
the technique I was using.
Yes.
There are, there are some more questions which have come in which have been answered in the earlier parts, but even if it's at a little cost of repetition, because she spent a lot of time typing this question.
Yes.
She's saying, I have a question that I and my parents never agree at a single decision or point. I can't even tell them my point of view, and then I feel anxious and very bad. I start crying because they don't understand me. It may be because of age gap, but how can I solve it?
Right. So the first thing is that we, like, using all the things that I have spoken about, I'm just bringing it back down together about how you can apply it. Okay. So the first thing is, do not personalize what your parents are saying, because we have to understand this goes back to parents tend to be protective. They always see you as this
not
size.
personalizing in more simple language. What do you mean by not personalizing?
So that, yeah. So what I'm saying is, for most parents, because this is how I feel about my nephews and nieces, I see them as this size when they came back from the hospital and couldn't do anything. So there's a huge need to protect them. Okay. And I think a lot of times when your parents are being very hard on you about something, it's coming from the fact that they want you to lead a comfortable life. They don't want any harm to come to you. They want to be able to control what you go through so that you have less trouble from their perspective. This is not to say that they are right. Okay. But this is their intention. So instead of seeing the words that they are saying, focus on the intention. That is the only way you can have a conversation with them, is if you try to understand the intention and you can get them to understand yours. Okay. If you are just saying, you don't listen to me, you don't pay attention, that goes into that whole aggressive finding fault mode. And then everyone is defensive and no one listens. Okay. So if you can reflect that, I understand why you are saying this. You are saying this because you think studying this will give me a steady income, or not seeing this guy who I'm interested in will, make my life comfortable, or whatever it is, all right, that your parents are not listening to you about. First, focus on their intention. That's the first thing. The second thing is, as a survival instinct, we have this need to please our parents. Okay, because when we are younger, if our parents are not happy with us, we will not survive. They are the ones who will give you food, they are the ones who will give you shelter, they are the ones who pay for everything. But we have to understand we have grown up. As long as you can deal with the consequences of your actions, right? If you are not listening to them, you have to be strong enough to deal with any negative ramifications that may arise. All right, then you have to be able to kind of carve out that path for yourself. All right, knowing that it may go wrong, knowing that your parents may be right at the end of the day, but this is something that you had to learn maybe the hard way. All right, so to know that. But most importantly, if you want to have a conversation with someone, it has to first come from a space of understanding their perspective, and only then will it be a conversation. Otherwise, it's just two differing people stating their opinions in a loud voice. So that is what will happen at the end of the day.
Brilliant answer. Really,
Yes.
really brilliant answer.
Yes.
Yeah, so I think I'm trying to skip the questions which are kind of overlapping or already been addressed. We dealt with panic attacks and anger, and there are a lot of questions around anger and panic which are coming in. Again, मेरा एक सवाल है, अपने गुस्से को कैसे कंट्रोल करूं? या same, lot of people are angry with many things.
Yes, this is the age to be angry, 17 to 25.
Yeah,
use that anger. Yeah.
Use that anger positively. But I really like your answer on the parents' part. Look at the intent. Have the conversation around the intent part of it, not around the look beyond the words. In any relationship, words tend to get harsher than the real intent behind those words. But if you still have differences, be prepared to prepare yourself.
Face the music.
Face the music.
Yeah.
So that's as frank as you can get. There is one very technical question which was there. I don't know. I've lost it somewhere. Okay. Yeah. Shourya, is there anything left? Or
No, not from my
list. Yeah. But anyway, I think Dr. Shah, really thanks a lot. We have, we've exceeded our time by 15 minutes. But it's been a pleasure talking to you, and I'm sure all our students who have been listening, and there are thousands of them that have been told to me. We'll get the statistics soon, but I know they are in several thousands right now, and even judging by the flurry of questions which are popping up on my screen. It's been a real pleasure and very useful discussions that we have had. And thanks a lot for sparing your time.
Thank you so much. Thank you so much for having me. I really enjoyed doing this.
And I just want to, and Dr. Shah is, volunteered that if there are still some queries you have, she has volunteered to reach out directly. And you can, that's the email address on the screen that you see. You can note it down. And any query that you may have, you can address it directly to her. Thank you all for listening in. I hope you got something out of it. It was a pleasure for Aptech to have Arena, Mac, Lakme Academy powered by Aptech, Montana, and all the brands that we own. For all our students, we will continue to bring to you all aspects of your youth, not only the education that we are looking at, or your vocational education that we are looking at. We really want to help you through all your life skills, your workplace skills, and also your life problems. Thank you so much, Dr. Shah. Thank you, Shourya. And thank you, everybody.
Thank you so much.
Thank you, Dr. Shah.
Have a wonderful weekend. Bye.
Bye.